Here is your latest Africa News Update.
Good morning, good afternoon, and good evening, wherever you are. The COVID-19 pandemic is straining health systems in many countries. The rapidly increasing demand on health facilities and health workers threatens to leave some health systems overstretched and unable to operate effectively. And I'm from Africa, as you know. And I know many people actually have to work every single day to win their daily bread. And governments should take this population into account, okay? If we're closing or if we're limiting movements, what is it going to happen to those people who have to work on daily basis and have to earn their bread on daily basis? So each and every country, based on its situation, should answer this question. We're not seeing it as an economic impact on a country, as an average of GDP loss or, the economic repercussions. We have to also see what it means to the individual in the street. And maybe I have said it many times, and I come from a poor family, and I know what it means to always, worry about your daily bread. And that has to be taken into account. Because each and every individual matters, and how each and every individual is affected by our actions has to be considered. And that's what we're saying. It's about any country. It's not about India. It's about any country on earth. Even the wealthiest country on earth can have people who need to work for their daily bread. No country is immune. Each and every country has to really make sure that this is taken into account. Specific attention should be given to low and middle income countries in Africa, Asia, and Latin America. In addition, WHO is working intensively with several partners to massively increase access to life-saving products, including diagnostics, PPE, medical oxygen, ventilators, and more. We understand that many countries are implementing measures that restrict the movement of people. In implementing these measures, it's vital to respect the dignity and welfare of all people. It's also important that governments keep their people informed about the intended duration of measures and to support for older people, refugees, and other vulnerable groups. Governments need to ensure the welfare of people who have lost their income and are in desperate need of food, sanitation, and other essential services. Countries should work hand in hand with communities to build trust and support resilience and mental health. With solidarity, humility, and assuming the best of each other, we can and we will overcome this together. I thank you.
For the latest news on the COVID-19 virus, please visit the Africa CDC website and the World Health Organization websites linked in the descriptions below. If you like informative and educational videos on Africa, make sure to like, subscribe, and hit the notification bell to catch all our latest videos. And please feel free to leave your suggestions, news tips, or topics about Africa you'd like us to cover.